Welcome. In this session, we will explore multiple sclerosis, a chronic immune-mediated disorder affecting the brain and spinal cord. Multiple sclerosis is a chronic immune-mediated disorder of the central nervous system. It is characterized by inflammation, demyelination, and progressive neurodegeneration. Clinically, it presents with episodes of neurological dysfunction that are separated in time and affect different regions of the CNS. Multiple sclerosis is primarily an autoimmune disease involving T-cell-mediated destruction of myelin in the central nervous system. Genetic factors, particularly HLA-DR2 and HLA-DRB1 associations, increase susceptibility. Environmental triggers such as vitamin D deficiency and prior Epstein-Barr virus infection also contribute. The disease is more prevalent in females and commonly presents between the ages of 20 and 40. In multiple sclerosis, the immune system mistakenly attacks the myelin sheath covering nerve fibers in the brain and spinal cord. This leads to demyelination, axonal injury, and the formation of characteristic white matter plaques. The resulting neuronal damage produces a wide range of symptoms depending on the location and extent of the lesions. Multiple sclerosis can be classified into several types. Relapsing remitting. Multiple sclerosis is the most common form, marked by episodes of new or increasing symptoms, followed by periods of partial or complete recovery. Secondary progressive multiple sclerosis develops in patients who initially had a relapsing course, but later experienced steady neurological decline. Primary progressive multiple sclerosis involves gradual worsening from the onset without distinct relapses. Progressive relapsing multiple sclerosis is rare and is characterized by progressive deterioration, combined with acute relapses. The clinical features of multiple sclerosis vary widely. Common manifestations include optic neuritis, leading to painful vision loss and sensory disturbances such as numbness and tingling. Patients may experience motor weakness, spasticity, and significant fatigue. Lermite's sign, described as an electric shock sensation down the spine with neck flexion, is a classic finding. Urinary urgency or incontinence and cognitive changes may also develop over time. The diagnosis of multiple sclerosis is primarily clinical, requiring evidence of at least 2 neurological attacks affecting different areas of the central nervous system at different times. MRI is crucial, revealing characteristic white matter lesions, often described as Dawson's fingers. Cerebrospinal fluid analysis typically shows oligoclonal bands and an elevated IgG index. Evoked potential studies may demonstrate delayed conduction, supporting the diagnosis. Management of multiple sclerosis includes 3 main components. Acute relapses are treated with intravenous methylprednisolone. Long-term control is achieved through disease-modifying therapies such as interferon beta, glatiramer acetate, and newer agents like fingolimod and ocrelizumab. Symptomatic treatment targets specific issues, baclofen or tizanidine for spasticity, amantadine or modafinil for fatigue, gabapentin or carbamazepine for neuropathic pain, and anticholinergics for bladder dysfunction. Multiple sclerosis can lead to significant complications over time. Progressive disability and increasing dependency are major concerns. Psychological impacts such as depression and anxiety are common. Patients are also at higher risk for urinary tract infections and osteoporosis, particularly due to immobility and steroid therapy. Collectively, these complications contribute to a markedly reduced quality of life. To summarize, multiple sclerosis is a chronic autoimmune disease of the central nervous system that causes demyelination. It has different types, including relapsing remitting, secondary progressive, and primary progressive forms. The causes are autoimmune, with genetic and environmental triggers. Diagnosis is based on clinical criteria, MRI, CSF analysis, and evoked potentials. Treatment focuses on intravenous methylprednisolone for acute relapses, disease-modifying therapies, and managing symptoms like spasticity and fatigue. Complications can include progressive disability, depression, urinary tract infections, and osteoporosis. Early intervention is key for better outcomes.